Imagine you are wrapping up a routine eye exam. The patient's vision is fine, but something in their motor control feels slightly off. You need a quick, objective way to check their neurological health before they leave the chair. To do that, we rely on a sequence of 5 essential reflex tests: the pupillary response, the blink reflex, the knee jerk, the Babinski test, and neck flexion. This diagram illustrates the spinal reflex arc. When we apply a physical stimulus to a receptor, the signal travels along a sensory neuron directly to the spinal cord and immediately loops back through a motor neuron to trigger an involuntary response, completely bypassing conscious thought. To conduct this screening in your clinic, you only need 3 things: your patient, a medical pen light, and a reflex hammer. Incorporating this sequence into a routine visit provides the specific clinical markers needed to identify neurological compromise. We start at the top. The eyes offer the fastest, most direct route to assess immediate cranial nerve responsiveness. First, dim the room lights. Then, take your pen light and briefly shine the beam directly into the patient's eyes. You are looking for a brisk, immediate, and symmetrical constriction of both pupils. Next, we test the blink reflex. Create a sudden visual or physical stimulus near the patient's eye, like a quick, out-of-focus hand flick near the lens. Confirming these 2 involuntary ocular responses instantly verifies the baseline integrity of the brainstem's fundamental wiring. Once the cranial nerves are checked, we transition our focus from the head down to the lower body for the patellar tendon test. Ask the patient to sit comfortably with their legs dangling freely over the edge of the exam chair. Using your reflex hammer, deliver a firm, brisk strike to the tendon resting just below the kneecap. This strike should immediately trigger an involuntary forward kick of the lower leg. However, you must abort this specific test if the patient has any pre-existing knee injury. When safely executed, eliciting this physical kick isolates and confirms the functional health of the specific lower segments of the spinal cord. Next is the Babinski reflex. This test is a general indicator of upper motor neuron integrity, providing a physical window into potential neurological damage. To perform this, take the firm handle of your reflex hammer and drag it smoothly along the bottom of the patient's bare foot, scrolling from the heel up toward the top of the foot. In a healthy adult, the normal baseline response is for the toes to instantly curl downward or push forward in reaction to the pressure. An abnormal response occurs when the toes do the opposite and fan outward instead of curling. In an adult, this fanning response is a clinical sign of neurological dysfunction, which is often observed in cases of advanced cognitive decline. But there is one major physiological exception to this diagnostic rule regarding age. While a fanning response is a red flag in adults, it is a normal, healthy physiological reaction in infants whose nervous systems are still developing. The diagnostic value of the Babinski reflex relies on the clinician applying the patient's exact age and physical reaction to the clinical context. Finally, we move back up the body to the cervical spine for the final step of our physical screening. Ask the patient to relax and carefully, gently push their head forward, flexing the neck until their chin approaches their chest. While holding this stretch, explicitly ask the patient if they are experiencing any pain during the motion. A completely pain-free stretch is the only normal result for this test. Confirming a lack of pain during neck flexion reduces the clinical suspicion of meningeal irritation, completing the physical baseline. You now have the capability to perform a comprehensive baseline neurological reflex screening right in the chair. In just a few minutes, you can confidently execute the pupillary test, the blink reflex, the knee jerk, the Babinski test, and neck flexion. This allows you to elevate your clinical communications. Instead of writing a referral that simply says patient needs assessment, you can provide exact data, like noting the patient exhibits an abnormal Babinski response. Providing specific, objective findings gives specialists the information they need to prioritize your referrals and move toward a definitive diagnosis.